We have crossed the 50 mark. So.
Session. Good afternoon, one and all. A warm welcome to the web clinic series of Science Society Setu for Atmanirbhar Bharat. I welcome all the eminent guests, delegates, and participants across various virtual platforms to today's program. The web clinic series initiative is aimed at harnessing science technology innovation related to social infrastructure. Since its launch on 15th October 2020, we are in the 6th week of web clinic series. The theme for this week is socially relevant STI for social infrastructure sector. These deliberations are looking for opportunities in locally productive and globally connected models, S&T interventions, and viable solutions for linkages for setting up the business, need-based scaling up technologies, and so on. The web clinic is being hosted, implemented, and managed by India Science Technology and Innovation Portal, ISTI Portal. The portal is centralized one-stop repository system for scientific research activities, which includes information on their intricate details, with the vision of providing a single window source of information about science in India by aggregating information on scientific inputs and outputs and disseminating related contents. ISTI Portal is an attempt to address the gap of identified issues and commute the impact of funding to enhance effectiveness. The web clinic is being relayed on Vigyan Prasar YouTube and ISTI Facebook page. Let us tune into the web clinic. The session moderator are Dr. Indupuri, Senior Scientist, Seed Division DST, and Mr. Rubab Sood from Peking. I welcome Debapriya Datta sir, Head Seed Division and Advisor DST, to set the context and share the thought process behind the ideas and execution of web clinic. Over to you,
sir. Thank you, Pooja. I think for starting the ball rolling, and good afternoon and namaskar, and welcome to all of you in this 6th week of this Science Society Setu for Atmanirbhar Bharat, this web clinic. When we started, we thought that whether we will be able to sustain, but it is I think a matter of little satisfactions, because I think we have been able to start the ball rolling by bringing all the stakeholders of taking the building the knowledge infrastructures in parallel or in come to supplement the government's investment in Atmanirbhar the Bharat program, which is in response to this the pandemic, the impact of the pandemic on the social and the economic different sectors. As all of you know that the Atmanirbhar Bharat program focus on immediate the financial interventions to boost up the physical infrastructures in the different sectors. But from the Ministry of Science and Technology, we believe that that should be complemented also with the knowledge infrastructure strengthening in order to utilize that investment. And in this context, the systemic gap, what we understand that the science and technology absorption capacity of the community or the citizens who are the ultimate users of the public investment, the knowledge updations mechanisms of the voluntary organizations or and the startups who are the setu of taking the knowledge to the community, and the knowledge generators, the developers, the knowledge organizations, their orientation towards the real life problems on the field. So this recent pandemic, it has created unique situations, and it's created many opportunities. So in order to take it in a positive way towards the self-sufficiency in a new normal world, we thought that we take advantage of this virtual world to start this web clinic where we can bring all these stakeholders, the community, the NGOs and the startups and the knowledge organizations together and discuss in order to find out that what are the new issues and new way of working, so that a cross-bridge collaborations can be developed for taking this, the advantage of the new and the emerging technologies to the for the development of the field. In order to strengthen the fulcrum of this Atmanirbhar Bharat, as you see here, is the technology-driven system and the infrastructure, the social infrastructure in this context. So we, as all, like many of you are with us, so you have gone through these objectives, but in crux, what we are trying to develop in this, the virtual platform, to bring this all the stakeholders and develop in cross-bridge collaborations mechanisms, so that we can follow it up with different types of the mechanisms which evolve to these, tuned to the requirement, and this what we are going to develop. We're going to discuss over these 8 weeks. Over these 8 weeks, we are already this is the 6th week. Over the 5 weeks, we have discussed in 3 weeks on the agriculture and allied sector. That's on agriculture productions and the innovation, the post-harvest technology, and then agriculture and the allied sectors, then MSME and the economic sectors. Then today we are starting the social infrastructure sectors. When we say the social infrastructure sectors, each week we are going to discuss this, the sectors from 2 ways: from the knowledge to the the users and the practitioners, which is called the STI for the society. Like this is this section today, where the experts from the knowledge institutions are going to discuss about the systemic issues and specific technological interventions to the non-governmental organizations and the community representatives, which can be taken through different collaborative mechanisms. Tomorrow, socially relevant STI, the community and the NGOs, community representatives and the NGOs, they will talk about that, what are the real challenges they find, like when they interact or try to develop the community through the knowledge interventions, and what are the opportunities to collaborate with the knowledge organizations, so that our knowledge production systems would be of more relevance to the problem of in the field. So this is the framework, and we expect that we will be able to develop a dynamic interactive and feedback-based systems where all these stakeholders will be involved, and ultimately we can develop a new mechanisms of the project support, which is from the Department of Science and Technology's point of view, but also interministerial the collaborations between the community, the startups and the NGOs, and with the knowledge organizations to make these our knowledge productions and the knowledge consumption systems aligned to improve the overall efficiency of our the entire system. Just for an example, just to share with you that each week, whenever like we are discussing, we're trying to find out that what are the new the initiatives or the new opportunities which is emerging. This is we did it for the for each of these week. I will come just to the last week's what are the opportunities we found. This last week was mostly the socially relevant the first day we found out a lot of the opportunity for the collaborations between knowledge organizations and NGOs, like the RUTAG mechanisms, which has been championed by the Principal Scientific Advisor's Office, how those technologies can be taken with the NGO for the MSME ministry, like have shown interest and interested to they collaborate for taking this technology to this Spurti cluster, promoting women-centric entrepreneurships. CRI Wardha, the technology what they have, we have already some experience. Model, so that will strengthen this entire delivery the chain. Similarly, Reliance Foundation, they have shown that how they are taking the high-end emerging technology to the grassroots innovations, which we saw initially also with the UNDP. So all of these things now can be emerged and converged, which is the current focus of the government and the directions from our honorable prime ministers. Similarly, the METI has a lot of community service centers, which can be used also for the knowledge context, the problem identification, communications to the knowledge organizations, and their skill development requirements, so that the skill, the knowledge, the skill, this organizations can work together for the requirement of the at the grassroots level requirement. NGO startups, we saw that there are many NGO, grassroots technologies are there, which can be, helped by the startups, the understanding of the business model to upscale. Similarly, Agni, which is another, incubator systems in the Principal Scientific Advisor's office can be brought here in order to strengthen this ecosystem. Internationally, we found out that the METI's CSC could be a very good, point to collect this, the problems and the solutions. So these are some of the new interventions opportunities identified. So in this way, this is we have named it as a web clinic, because it is not only a one directional, the prescriptions, or it is not a one directional talk. It is a both or multi-dimensional talks, because the problems of Atmanirbhar Bharat is like as we go more and more, to the real stakeholders, it's a much more complex. We need all these stakeholders to work together, and therefore this web clinic, what we are trying to develop it as a permanent virtual platform where these dynamic interactions can take place. Therefore, as you see that we have put it here on the right side as a follow-up of our this 2.5 to 3 hours of discussions. You can submit your ideas, your problems, challenges, and the questions, answers. Please, you register, and whoever is attending, please register and utilize these mechanisms, because this is all ours mechanisms. If we don't start using it, the platforms cannot. So this is overall what is in our mind and what is our experience over this last 5 weeks. We slowly we are getting these confidence that these interactive mechanisms, I will claim that we have achieved what we're looking for, but the type of the response and the ideas and the new collaborative mechanisms we have got, that gives us a lot of confidence on that, so that we can instill that the Atma Vishwas and the Atma Sanman in the community for a sustainable Atma Nirbhar Bharat. So this is with this context. I request my colleague Mrs. Indu Puri to take over for conducting this session. Thank you very much.
Thank you, Dr. Datta. Thank you very much for context setting. I hope I'm audible. Am I audible?
Yeah, you're audible.
So a very good afternoon. A very good afternoon to all of you, and we welcome you to the 6th week of this series, of the web clinic series. We are focusing on the social infrastructure segment, and with social infrastructure segment we mean that कि एक सामाजिक बुनियादी ढांचा जो कि अच्छी community के लिए चाहिए. This includes fundamental services like transport, then internet connectivity, education, healthcare infrastructure, and we will be talking a lot about it. And as Dr. Datta has mentioned, we will be having knowledge organizations today, and then there will be NGO partners, and how to bridge the gap and how to make the social infrastructure available to more and more stakeholders to take the program further. And we also wish that this will help us in taking sustainable development goals of the society and make Bharat truly Atmanirbhar Bharat. So we have lead speakers and we have panel discussions also, and I have my moderator partner Mr. Rubab Sood from FICCI, and we have our facilitators Dr. Uma Malik and Dr. from Vigyan Prasar we have Prabhat Ranjan ji. So I will start with the first speaker first. She is Dr. Veena Rao. She is from Karnataka Nutrition Mission, and she is a retired, Veena Rao ji is a retired IAS officer, and she will be talking on energetic and cognitively strong social capital. So social capital is the essence for the social infrastructure. So Veena ji, over to you then. We will do the presentations, we will be turning them, and you can start. Are you there, Veena ji? Veena ji? Veena Rao ji? Hello.
Veena Rao ji, I think you need to unmute your mic. Her video is clear, but I think audio may.
Yeah, is that fine?
Yeah. Now you are audible, ma'am. So we welcome you.
Great.
Are you ready to present, ma'am?
Yes, absolutely. And
Sure,
before I
ma'am.
start,
Over
I'd
to
like
you.
thank you very much. And before I start, I'd like to thank Dr. Datta and all of you for inviting me here. I think it is a path-breaking initiative that the Department of Science and Technology of all human resource development departments, I mean, it's absolutely, one of the most path-breaking things I have heard in my career, because I never expected human resource, social capital, quality of life, livelihoods, equity, and all of this to be discussed here in science and technology. So it is really wonderful that you're doing it. And I'm very certain that with the present leadership that you have in the ministry, this is really going to take a lot of systemic gaps, which you have mentioned throughout in your paper, not just systemic gaps, but also a lot of structural gaps. Because you talk of gaps, you don't talk of programs. So honestly, it's really refreshing. Now let's start. And can we have the next slide? How do? Yeah, thank you. Yes, that's right. Let me just put this on. We can't do that. Okay. Yeah. Okay. So let's just start by defining what do we mean by social capital. Obviously, we mean our human resources. And most importantly, within those human resources is the demographic dividend. of which India is very proud, because we say that for at least 3 more decades, we are going to have about 67% of our population between 15 and 59 years. And obviously, we are very aspirational. We want to be a world power. We want to progress very quickly. We want to be Atmanirbhar, as is the theme of this. So our social capital basically is the engine which has to drive it. Regardless of what approach you take the human resource approach, the science approach, any approach. It is your human resources which has to make it work. All right. How do we measure? Next, please. Next. Right. Now, how do we measure social capital? Well, over the years, last 2 or 3 decades, ever since the development studies have progressed, the strength of the social capital is there are very commonly agreed upon indicators. One is per capita income. You have literacy rate, especially female literacy, health, nutritional status, mortality rates, etc. Now, I'll just give you an account of some of them and where we stand. We just compared India with China and Malaysia. Malaysia is our neighbor, both are our neighbors, and both started far behind us. Now, I'll start with the per capita income. India is 6,427 USD. China is 15,309. Malaysia is 26,808. All right, then we come to literacy rate. We have been improving. It's not that we haven't improved. Even per capita income almost doubled over the last 6 years or 5 years. It has doubled. Literacy rate continues to improve, but as on date, our literacy rate is, from the census, 73%. China is 95%. Malaysia is 93%. Female literacy, again, ours is 64%. China 99%. Malaysia 98%. I won't go into the other figures of the infant mortality rates, the maternal mortality rates, but we have a very long way to go. So, and as it appears today, we are pretty much behind a lot of our neighbors, and we have to do something to fill in the gaps, as you emphasize. Can we go next? Next, please. Right. Now, I'm only going to focus on one particular method of measuring the strength of our demographic dividend, and that is the nutritional status. Now, nutrition, food, is the basis of all life, whether it is plant life, whether it is animal life, and definitely when it is human life. And food means there is a very well-established scientific method of calculating the calories, the proteins, the micronutrients, and the vitamins such as iron, micronutrients such as iron, iodine, calcium, which are required for healthy growth, healthy life, and healthy working capacity. Right now, what is the position of our social capital as far as that is concerned? We've had a succession of national reports, national surveys on this subject, starting from 2012, that is the National Nutrition Monitoring Bureau, 3rd repeat survey, 2012, our own NFHS, which has come out just last year, and the next technical report of NNMB, which is 2017. You can study all of them, and there is a clear indication, there is a clear, clear data which shows that at least 50% of our social capital suffers from undernutrition and micronutrient deficiency. Okay, can we go next? Next, please. Right. Now, what are the reasons for this? This is an established fact, even though it is not acknowledged, it is never stated either at policy level or at even, the more local levels. We talk about public distribution system, we talk about midday meal program, we talk about ICDS, but we never talk about this very critical finding, which has been repeatedly covered. So, okay, what are the reasons for this deficit? The reasons, one is that the daily diet of at least 40 to 50% of all age groups has a very huge dietary deficit. Now, that is for several reasons. One is poverty, one is tradition, one is a lack of knowledge. So we come to the next deficit, which is the information deficit. A large section of the middle classes also, the lower middle classes, and definitely the more marginalized and the lower income groups, they do not have knowledge of what is a balanced diet, why it is important, and how do you create a balanced diet within family budgets. Now, every village, as we know in India, has a lot of very valuable horticultural, fruit, vegetable all around. There is greens everywhere, there are bananas everywhere, there are papayas everywhere, all affordable, but they are not eaten. The routine diet of a agricultural or construction laborer is dal roti in the morning, dal roti in the evening, nothing else. Even though greens are freely available, they can even grow them. Anyhow, that is a sort of a tradition and a complete lack of information. And so far, we have never had a grassroots program to inform the families and communities about this. And then lastly, I would love to emphasize, and since I think somebody from FICCI is already here, this is a subject I've discussed with both FICCI as well as with the CII for the last 10 or 15 years. There is a huge market deficit. There is of energy food, fortified energy food, which is affordable. The market is full of expensive energy food, and it keeps getting added because I watch the shelves often. But affordable energy food, there is nothing, though there are a lot of affordable snacks, which are more or less like junk food. Now, why this is the case is something, well, we have to find answers for that. Now, what is the result of this triple deficit? Next, please. Next, please. Right. Now, what is the result of these three deficits on our social capital? As far as children are concerned, I think it has been scientifically established that the largest part of brain formation happens between 2 years, 0 to 2 years, even gestational, and definitely below 2 years. That is scientific findings well established. And it is extremely unfortunate that even from NFHS, the percentage of children getting adequate nutrition less than 2 years is less than 20%. It's hardly some 16 to 18%. Now, what is the result of this? The result is lower cognitive development, lower physical development, stunting. We keep on talking about stunting, but if you look at the figures below 2 years in NFHS, we shouldn't be surprised because there is such a huge dietary deficit for children. Then you have wasting, you have anemia. And added to that, there is lesser ability to learn, there is lower immunity and higher infections. Now, what is the effect on adolescents? Now, children are our future social capital. Adolescents are our immediate social capital. Now, we keep reading in education surveys that there is a very high percentage of school dropouts, then there is very poor learning and poor numeracy skills. And this is the direct result of poor brain formation, less than 2 to 3 years, and therefore lesser capacity to acquire skills, education skills, to study. Now, what is the result? Further result of that is that without the best the best learning skills, obviously the income generation will also be adversely affected. The kind of jobs that such people will get will certainly not be the high income jobs. And then that poverty cycle continues. And more than that, the adolescent girls who are undernourished, they become undernourished mothers, and the intergenerational cycle of malnutrition and poverty goes on. What is the result of this on our present social capital, that is the adults? Well, chronic energy deficiency, anemia.
One gentle reminder, you've got 4 more minutes to go, Vigyan. Thank you.
Okay, sure. Yeah, so reduced capacity to work. All right, so then let's go to the next. Right. I would like you to just note, this is a very interesting quotation from Professor Vogel, a Nobel laureate, and he says, the first law of thermodynamics applies as strictly to the human engine as to mechanical engines. So there is no energy, there is no, there is lower work, and then there is lower income. So that is the energy situation of our workforce in India today. Next, please. Right. Okay. Now, in the COVID and post-COVID situation, there is not just from field reports, but there is a survey done by the Azim Premji University, which indicates that hunger deaths are increasing, food intake is going down, and of course, we all know that a lot of job losses. Next, please. Right. Now, how does science and technology comes in? I think a lot has been spoken of knowledge hubs, knowledge centers, right? We do have knowledge centers in the national capital, of course, I'm sure in all the state capitals, but the lower down you go, maybe in certain subjects like IT, you may be having, agriculture, you may be having, health, you may be having a few, but nutrition, nothing. That is where science and technology has to come in, because we have to inform the people that this is how behavioral change must happen for them to acquire knowledge of how they can manage to be healthy within whatever budget they have. And we have no literature on this subject in various regional languages, at least not in Karnataka. That is one way I request the science and technology to innovate and help us. How can we establish knowledge hubs in areas which can directly disseminate knowledge to the community and to families? Secondly, fortified energy food has to flood the markets, both rural, urban. The local industry refuses to enter, even though we got a study done by KPMG under the World Bank project, which I was implementing, that there is an annual demand of 42 million tons. And strangely, in India, we produce fortified food and we send it out, we export it to other countries, but we don't give it to our own people. I think that is very inequitable, and we have to do it. And if the local food industry refuses to come in, we have to create capacity within our systems of self-help groups, panchayats or whatever. And there we require the role of Department of Science and Technology. I'm in very close contact with your your society here, the Science and Technology Society, and we have already worked on it. And I think Professor Datta knows that we are trying to set this up through your own seed program in the aspirational district of Yadgir. Next, please. Next. Right. Now, I'll just run through this because we must bridge the information deficit, the calorie protein deficit. We must create a cadre within villages who can disseminate information. And my finding from the project I have implemented, which I'm describing all through, that very clearly established that there is no substitute for interpersonal counseling. You have to create this this group of informed, trainers in a village. And there I would like to have further discussions with the Department of Science and Technology. Next, please.
Ma'am, we would request you to wrap up in like
Sure.
a minute or that.
Sure. Right, we can run through this. There is data given about how this technology works. Please go to the last slide. So the impact assessment gave very, very positive findings as to how the social capital improved with this strategy. And I would like to just add to, before I close, way forward, as I said, create the cadre of nutrition volunteers, create knowledge hubs, and address the deficit with small businesses. And your society here has rural technology which can very easily be used. Green technology. Next, please. Next. Last. I promised you that's the last. Oh, I think it automatically gets. Excuse me?
Yes, Veena. Do you have another slide after the last one?
No, I do. I just want to say something which I think is useful.
Sure.
Just one thing, please. Yeah. Right. Can you go next?
Yes, Dr. Veena. You're audible.
Thank you. Okay, I just like to say something that when we plan something, as you said, we are filling in gaps. We are not just trying to address systemic but structural changes also. We must remember that, bringing qualitative changes in social capital is a time-consuming thing. We cannot have a project for 3 years and say, okay, now you take care of yourself. So we can, when we create any program for them, it should obviously it should lead towards sustainability, certainly. But please let us remember that there always has to be a guardian for at least another 5 years to ensure that it is functioning the way it should and it doesn't get abandoned and it achieves sustainability. That's all I have to say. And of course, durable partnerships, you yourself have said. Thank you so much. And sorry if I've gone past my time.
Thank you, Dr. Veena. Thank you so much for your insights on the nutritional aspects of the society. And really, the zero hunger is one of the sustainable development goals, and India is committed towards it. And you have thrown a light on the Human Development Index also. Perhaps the solution lies with the locally available natural resources, अनाज जिसको कहते हैं, millets and all other things which are low-cost diets and which can provide wonderful meal planning and all that. So we will talk more about it and we can have projects on that also. And now I will take you to our next speaker, Dr. Pranav Jha. I invite you, sir, from IIT Bombay. He will be throwing light on the broadband connectivity to rural India. And as we all know, rural India is only 30% or so connected with the broadband connectivity, and this pandemic has shown us that how badly we need the broadband connectivity. And if we have more connectivity, people can work from home even in rural India, and we can have really a decentralized economy. So over to you, Dr. Pranav Jha, sir. I welcome you on behalf of DST and on behalf of all other our sister partner organizations.
Yeah, thank you very much. I hope I am audible.
Yes, sir, you are audible.
Yeah, thank you very much.
And I would request the speaker, Veena ji, if there are any questions or some comments which are sought from you as replies in the chat window, you might please refer to that meanwhile. Thank you. We'll take the questions after the panel discussion is over. Over to you, Pranav ji.
Yeah, okay. Thank you very much. So I would like to thank DST and Dr. Datta and Dr. Malik and Dr. Bhogat, everybody, for allowing me to speak here and present our idea. So maybe we can go over to the next slide, please. Yeah, so this is the agenda for today. I will briefly touch upon the status of the internet and broadband connectivity in India, specifically on the rural India. And then we will talk about the key challenges to this rural broadband connectivity problem. And then we will discuss Groundmark, which is our project started at IIT Bombay in 2012 by Dr. Professor Abhay Karandikar, and the different aspects of Groundmark. So the other items are below, which are basically related to Groundmark. Yeah, let us go to the next slide, please. Yeah. Yeah, so this slide shows the internet and broadband penetration status in India. So you can notice that we have around 135 crore population, whereas the connectivity to internet and broadband is around 75 crores. So it is possible that around 60 crore people do not have access to internet and broadband. And if you look at the rural population, it seems that most of this 60 crore or a majority of this 60 crore reside in rural areas. So let us go to the next slide, please. Yeah, I'm just trying to rush through it so that we finish in the stipulated 15 minutes, and then we can take the questions. So this slide actually talks about how broadband access is enabled typically. So if you look at the developed countries, it is generally enabled through wired or fixed line communication. So the fiber or DSL connectivity at homes, they provide the broadband connectivity. However, the developing countries, say a country like India, it is generally provided through cellular connectivity or wireless connectivity. You can see on the right-hand side, the wireline tele-density in the country is around 2%, which means only 2% of the population probably have access to fixed line infrastructure. And that is even lower in rural areas, which is 0.3%. But the cellular tele-density is much higher. It is around 88% for the country, and it is around 60% for the rural area. So essentially, the cellular technology is used to provide broadband or internet connectivity in the developing countries. However, there are some issues with the cellular technologies as well. The operators roll out cellular network. First, they roll out in urban areas because the return of investment is better in urban areas, and rural areas generally lag behind in those aspects. So there is a lesser incentive for operators to go into rural areas. The other aspect is also that the technologies like 4G and 5G, they are more focused on urban-centric use cases. We will just look at that aspect later also. Yeah, let us go to the next slide, please. Yeah, now this slide actually talks about some of the key challenges that you face while you try to connect rural India. So, if you look at the rural population distribution, you will find that it is generally sparsely populated. So you have villages, and then there are a lot of open and empty spaces between these villages. So the right-hand side, there is a figure taken from Google Earth, and you can see that the circles mark the inhabited areas. However, the rest of the areas are empty and open places where very few people or nobody is there. Then a lot of regions or rural regions are difficult and remote and difficult to reach. So it is not easy to take the infrastructure there. Then it also costs high capex, and maintenance of the infrastructure is also costlier in rural areas because of these remote location and because of the distances that you need to lay these infrastructure for. And the last, on this slide is that the average revenue per user in the country for telecom services is pretty low. For the cellular services is around 75 rupees in 2019. It probably would have increased a bit in 2020, but it is still much lower. And this is lower in rural India further. Yeah, let us go to the next slide, please. Okay. There are other challenges too, like scarcity of resources. So there may be issue of uninterrupted day 24/7. A lot of times the power from the grid is not available. Then when you try to deploy the infrastructure, you may have access constraints like right-of-way issues and so on. And then when you deploy the infrastructure, you need to maintain them, manage them. So it is also difficult to get trained manpower in rural areas or villages to maintain and manage these equipment. And last, which probably is a very important reason, is that relevance of content. So a lot of content on internet or whatever, available in English, or a lot of it is available in most of the foreign languages. And that may not be very relevant for people who are living in rural areas in our country. So that's a big challenge and big issue, which probably we should look at very carefully. Okay, so let's go to the next slide, please. Yeah, so Groundmark is a project which was started at IIT Bombay to provide rural broadband connectivity by Professor Abhay Karandikar. And the goal was to enable rural India digitally through internet connectivity and help in the economic development of that region. So we conduct R&D to connect remote and unserved rural areas, and we have developed scalable and low-cost communication technology for villages. Essentially affordable rural broadband connectivity solutions. And then we also looked at, at creation of a sustainable business model, which can utilize the Gram Panchayat as its apex, and then try to create a sustainable business model for any connectivity. And then we have also tried to study socio-economic impact of the internet connectivity. So that's the goal of the Groundmark project. Yeah, let's go to the next slide, please. Yeah. Yes. Now, based on the challenges that we discussed earlier, some of the key points that we need to look at when we want to provide affordable rural broadband connectivity is that it has to be low-cost solution. Both the equipment, which we deploy in the villages, and the backhaul which connects them, both of them have to be low cost. Spectrum is a big cost for connectivity, and we can, you try to use unlicensed spectrum wherever possible. And the fiber backhaul is generally more expensive than wireless backhaul, so we should prefer. It would be preferable to use wireless backhaul to reduce the cost. And then it is typically, as we discussed, it will be a wireless or cellular kind of infrastructure that will provide affordable rural broadband connectivity. So, but the point is that most of the mobile or cellular solutions focus on high-speed mobility. If you look at the 4G, it focuses on some 375 kilometers per hour kind of mobility, and 5G is focusing on 500 kilometers per hour, but those are not really required in our country, and especially in the rural areas. We are basically talking about fixed access here. And then, it should be energy efficient solution, and that's very important because energy from the grid may not always be available. So if it is less, if it is the consumption is low, then we can use solar energy or other forms of energy to run this, which will reduce the cost as well as the, it will be easier to manage. Yeah, next slide, please. Yes. Now we will quickly just touch upon the 5G, which is a hot topic these days, the last few years. And so the question that we want to understand whether 5G will help in this, connecting rural India. So if you look at the key use cases and KPIs, you'll find that they are hardly related to rural areas or rural areas of developing countries. They are mostly focused on urban-centric use cases. They focus on very high-speed data rate of 20 Gbps and high-speed mobility, 500 kilometers per hour. Very low latency, say to the tune of 1 millisecond over the air, and very high density of mobile devices, which is basically 1 million device per square kilometer kind of density. This is for IoT use cases and so on. But they don't really focus on energy efficiency or large coverage areas, which are really required to support connectivity in the rural areas. And we think that the cost of the equipment may be higher because the focus of the technology on these aspects, and it may not be very well aligned to support rural broadband connectivity. So, the conclusion is that it may help, but it would require modifications. So let's go to the next slide, please. Yeah, okay. So this frugal 5G network is our vision that we created at IIT Bombay to provide connectivity to rural areas, which is basically, we have proposed a communication architecture, network architecture, which can provide affordable broadband access, and which addresses the requirements that we discussed earlier. Yeah, next slide, please. So our focus is that this is a high-level view of the architecture that you might be aware of this BharatNet project, which is trying to take fiber connectivity to all Gram Panchayats. Recently, our Honorable Prime Minister also talked about taking it to all villages also in the next couple of years. But so if it reaches to all Gram Panchayats, then we propose that we can take that fiber point of presence to Gram Panchayat and use it for providing connectivity to nearby villages. So from the Gram Panchayat, we can use wireless backhaul to reach these all these villages of the same Gram Panchayat, and then inside the villages we can use high-speed Wi-Fi access points to provide connectivity in the villages. So the idea is that we don't need a coverage throughout the area for Wi-Fi or high-speed access, because villages are just have Wi-Fi access points inside the villages, and then we have connectivity through wireless backhaul to the fiber point of presence, which is in the Gram Panchayat, and then from the Gram Panchayat we take it to the internet. Yeah, so next slide, please. Okay, so now just a couple of slides are remaining. So this is our learning from Groundmark testbed, which we deployed in Palghar district in Maharashtra in India. And so it is basically based on that Google 5G network architecture. So we have wireless backhaul, for which we use TV UHF band, which is 470 to 590 megahertz. This is basically the band used by Doordarshan for providing Doordarshan services. However, our study shows that a large amount of this band is generally unutilized, so it's not in use many times, and it can be the spectrum is very useful in the sense that it can cover large distances, and it can also provide non-line of sight links, and it also consumes low power. So all these characteristics ideal solution for wireless backhaul from the Gram Panchayat to villages, and we used it for our test bed. And then inside the villages, we deployed Wi-Fi access points for high-speed access inside. So all these, the wireless backhaul is also based on Wi-Fi kind of technology. We modified the Wi-Fi base station to work in the TV UHF band normally. So the whole solution, that is essentially based on Wi-Fi in a way, and it is quite cheap and very cost effective. Yeah, next slide, please. Okay, so we, and a few of other learnings was that, we could reuse a lot of infrastructure and we could share it. We found that a lot of towers or some government buildings are available here and there, so we can use them for our, deployment of the devices, which can, so it reduces our cost. And then we use solar power because the power consumption of the devices was much lower. So we used solar. We could use solar power.
Dr. Jha, may I request you, you have to wind up in 2-3 minutes, sir?
Yeah, I'm almost finished. So I'm just keeping track of the time here. So I'll be finishing. This is the second last slide. So yeah, and then we developed a network planning tool, and as I discussed, the 470 to 890 megahertz is and allocated for fixed mobile and broadcasting, but it is a big part of it is given to Doordarshan for broadcasting. However, it is not always used, and government may take a look at the spectrum aspects. The next slide, please. Yes, I think this is the last one. And then we utilize the local youth for the deployment minutes. So we provided some basic skills. The devices are simple, so we could do that. We also collaborated with Common Service Center for some of these deployments. They have this VLE model where they use local youth to manage devices and so on. And then we created a small, sustainable business model where the Gram Panchayat was owning the resources and they were distributing it to villagers at some nominal cost, and villagers could use the network, and they could use it for whatever essentially it was community ownership under the control of the Gram Panchayat, and that was. I think this is the last slide. So thank you very much, and I'll be ready to Okay, so there is conclusion. Yeah, so I think I've broadly talked about it. So I'll be ready to take any questions.
Thank you, Dr. Thank you, Dr. Pranav Jha. Thank you for the wonderful presentation on broadband connectivity in riots and community ownership. That was very insightful, and usage of renewable energy and solar energies can also provide the solution for increasing the broadband connectivity in rest of India. So now I would request the next speaker, Dr. Rupal Dalal from IIT Bombay. Dr. Rupal Dalal would be talking on emerging technological solutions to improve maternal and child health and nutrition, because this is a very important area, maternal as well as child health and nutrition. So, Dr. Rupal Dalal, may I request you to start your presentation?
Yes, thank you so much for inviting me to talk about literally my passion. I'm a pediatrician by profession, but I'm also professor at the Department of Sitara, Center for Technology Alternatives for Rural Areas at IIT Bombay. And I'm working with different projects, with different departments in IIT. So one of the projects that I'm working is with spoken tutorial, which has been run by Professor Kannan. And so I'm going to discuss mainly about that project of mine. And it's basically what we are doing is we are working on technological solution to improve maternal child health and nutrition. In this time of COVID, this would not have come at a better time really, because as Dr. Veena actually set the foundation for my talk, and I really appreciate her presentation. And a lot of studies are coming out, not only Lancet, but even in Indian journals on how children are basically getting malnourished because of past 6-7 months of lockdown. So next slide, please. Okay, so this is our latest NFHS4 data, and this shows the age-wise distribution of malnutrition in children. Children are very vulnerable because if they are not breastfed properly, or if the complementary food is not started properly, then they have a high risk of getting malnourished, and that has a long-term repercussion on physical as well as mental growth, which Dr. Veena already mentioned. So I don't want to go too much in detail about the technicality, but if you look at this slide, basically the red bar is your wasting. Wasting means the child is too thin for that height. Okay, and if you look at it, the highest number of children who are SAM, your wasted children, are basically between 0 to 2 months of age, and that's about 34%. So that tells you basically your maternal nutrition. At the same time, breastfeeding not going right. So obviously there is not improper milk transfer, which is occurring during probably this first few months of life, that baby should be gaining or should be having a catch-up growth. That is not happening. Or even if babies were born normal with normal weight, they are faltering. They are doing a growth faltering. So they're going down the curve. And when you look at this 1 to 2 years of age children, so this blue bar is your stunting. Stunting is basically short height. So obviously the short height occurs over the period of time. It's not acute. It doesn't occur over a period of 1 or 2 months. It occurs over a period of 6 months, 8 months of improper nutrition. And basically this high stunting in this age group means basically this first year of child life, child did not get proper nutrition. And as underweight goes up, your stunting goes up. So as you can see, basically after 1 year of age, all your markers of stunting and underweight are higher. Next slide, please. And this is again, Dr. Veena mentioned about the lack of knowledge, and I completely agree with that, because I've been working in slums of Maharashtra and also in rural tribal areas of various states for past 14 years. And what I realized, this is an issue not only in illiterate population or poor population, but I do see a lot of mothers who are educated, and also kind of even doctors and engineers and professors I help through this technology, and most of them have a total lack of knowledge on breastfeeding skills, on complementary foods. They have no clue what food to start, how to start, how many times to give, all that, or what actually what consistency. So those are all very important aspect of nutrition in first year of life. So here this is again NFHS 4 data, where it shows that the highest, richest children in India, so the highest wealth quintile, almost 1 in 5 children are malnourished. And why should they be malnourished? So it's literally lack of knowledge. And even middle class, upper middle class, almost 30 to 35% children are malnourished. So this is clearly like a lack of awareness on importance of nutrition. Next slide, please. Working in again, different parts of India, what we learned, we went through a learning cycle. So being a pediatrician, literally we were trained on a lot of therapeutic aspect of pediatrics, but again, our training on nutrition was pretty little, not much. We were not taught on breastfeeding. And I can imagine if the pediatricians are not taught on nutrition and breastfeeding, then I have no clue how those healthcare workers and other women, who are taking care of the children in slums and rural areas know about the nutrition. And literally, I think we went through this cycle of learning, and we realized that a lot of the skills that we were teaching to mothers, they were not giving us results. Means our children were not gaining weight, and that's when we realized the loopholes. And once we kind of worked on those loopholes, we understood the issues, and once we started kind of implementing those new learnings in the field, we just started seeing amazing results in the field, which I'm going to show you or share some of the results that we are seeing in the field after going through this learning process. And 3 years ago, we presented our data in the World Breastfeeding Conference, and WHO people were also there, and they were really amazed by our results. And IIT Bombay actually approached us, and they said that why don't you give us your content of what worked in the field, and we will come up with tutorials for you in multiple languages, in Indian languages, and basically we can pass on this knowledge, and this is not only just on breastfeeding, as Dr. Veena was mentioning, it's also about nutrition, balanced diet, protein-rich food, everything from, and throughout life cycle, not just for mothers and pregnant mothers, but for adolescents, for older children, for just basically on pretty much everything, So basically, Spoken Tutorial was, the project had started in 2009, and it was basically funded by NME ICT, MHRD. And initially, it was started mainly for software learning, learning, and to improve the employment opportunity for college students. During that time, up till now, about 9,000 spoken tutorials has been made, and basically this is the largest IT training program in Indian language. And total about 4.5 million students has been trained using the spoken tutorial. And we have about 36,000 college lab courses, and cost to have this IT training through this project is less than 50 rupees per person. And this is more for, of course, main spoken tutorial project, which is mainly on software learning. But in 2017, basically we started this making health spoken tutorial in mainly on maternal financial nutrition and basically adolescent also. Okay, next slide. Okay, so what is spoken tutorial? It is a 10-minute long. It's audio video tutorial. It is created through screen capture with a running commentary. Now, the reason we did not want to have any write-up on this tutorial, because our target audience was basically probably an illiterate girl in that remote village who get time to learn new skill only at night. So our focus was basically, not only doctors and nurses and nutritionists, but even a person who cannot read or write but can understand the spoken language. Mainly, basically, it is designed for self-learning, as we say, Atmanirbhar Bharat. And right now, if you look at all these teenagers, they're crazy about do-it-yourself videos. Even in US, I'm trained in US and I continue to work in US. We have something called Khan Academy, where basically everybody learn from Khan Academy YouTube videos. These are totally free videos, and on a similar basis, basically health spoken tutorials completely based on that philosophy, is that you learn on your own about your health, about different skills. So totally free access to our YouTube videos. If somebody wants to download these videos to show in offline mode, if there is no internet connection, then for less than 100 MB, basically 99 rupees plus GST, and up to 250 rupees for up to 1 GB download. And how we do it? What we do is we initially create tutorials in English, and then basically this English is translated into 22 different languages. In fact, recently we have also started translating this video into Korku, which is the tribal language which is spoken in Melghat. Now, Melghat has some of the highest number of malnourished children, and they have very high infant mortality rate. So the local government came and said that, we have this issue, please come and help us. So we have created a tutorial for them, and there is one more which is coming up in Santhali. So what our goal is to basically create tutorials in multiple tribal languages as well, besides your Indian constitutional languages. You can watch this tutorial offline as well. So if you don't have internet access, you can just basically show this tutorials offline. Okay, next, please. Okay, so initial focus was 4,000 days, but we have expanded to throughout the life cycle, nutrition throughout the life cycle. These tutorials are basically created, and basically we have nutritionists, we have animators, we have pediatricians who are helping us with the content. We have basically a PhD graduate who is a project manager. So, basically, and whatever we prepare, basically it is completely evidence-based. So when we write the script, we cite each and every recommendation. So first 44 tutorials are already ready in English, and we have basically in Hindi we have almost 39 tutorials ready. Next slide, please. Next slide. Okay, and how do we do this? We basically conduct large-scale training on nutrition through the spoken tutorial methodology, where basically the target audience is your urban and rural parents, healthcare workers, AAAs, Anganwadi, ASHA workers, ANMs. We have also trained medical officers and nutritionists and private doctors using these tutorials. Recently in Banaskantha district, there is no dilution of knowledge. So basically because of this tutorials, whatever knowledge that we want to pass it on, basically 100% passes on. Because normally what happens if you don't have any tutorial like this, there is a dilution of knowledge when you do TOT, training on the trainers, and aim is to cover the entire landscape, to be shared, to be frank. Okay, next slide, please. I'm just going a little bit faster. Okay, this is our website, spoken tutorial website. You can just download, and basically it comes under health and nutrition series. There are different series, so our tutorials come under health and nutrition series, and there are different languages, so you can basically pick any language that you want, and you will come across all these tutorials in that particular language. Next slide, please. Okay, this is our YouTube channel. This is under Health Spoken Tutorial IIT Bombay. It would be a good idea to subscribe to it and keep the notification on with the bell sign right next to it. And again, it has all the different channels. So first would be English. You click on English and you'll have about 48, 49. Our goal is to create 80 to 100 tutorials. So we are so far at 45th right now. And you have Tamil, you have Kannada, you have all the languages. Next line, please. Next presentation. Next. Okay, now these are the 44 tutorials that we have prepared. They are not, we have many more than this. As I said, we have individual nutrient also we have talked about, recipes in vegetarian as well as non-vegetarian recipes for individual nutrients. Junk food we have videos on. We have videos on hygiene. We also have videos on KMC, kangaroo mother care, making a KMC bag, how to make them at home. Newborn care. So basically pretty much everything, growth charts, just name it and we have all the videos. Next slide, please.
Dr. Dalal, we've got another couple of minutes for you to wrap up, please.
Okay, so this is the general guideline. So this is, obviously this is in PDF, but when you click on the video, this comes like this, so we have on multiple languages again. This is probably in Gujarati. Next one, please. This is KMC again in Marathi. Okay, next. Okay, this is our result in one of the project we had done in urban NGO, and so once we started teaching them on the same methodology to mothers, so we had about 286 babies come in at average age of 2 months of age, and we basically checked the results at the end of 1 year. This was an urban slum of Mumbai, and if you look at it, almost 70% reduction of severe wasting, almost 70% reduction on severe underweight, and also severe stunting reduction and stunting reduction. Very difficult to find stunting reduction actually in the field, but using this methodology, we could basically get this change. We did not give any supplementary food. It's only basically counseling of skills of breastfeeding and complementary feeding. Next slide, please. Next slide, please. Yeah, can I have a next slide, please?
I think there is some issue. May I request Vigyan Prasar team to plug in the next slide, please, if it is possible?
Ma'am, there is some technical issue.
Okay. Dr. Rupal, there is some technical issue.
Okay, so basically, yeah, there are a few slides, and just wanted to show some of the results that we have worked in one of the district called Banaskantha. And with what we did, basically, we trained all the healthcare team here. This is Banaskantha district training. And what we have done is we have trained the whole team of Department of Health using this tutorials. And here, this is, once we train them, this is TOT, training of the trainers. So they were showing this tutorials to their mothers and their their healthcare workers. Keep going, and so there is no dilution of message. Here the mothers have come to PHC and they're learning breastfeeding skills before they deliver. Okay, so they're already kind of expert on 45 points. There are 45 points that we focus on. This is medical officer showing mother at PHC, during postnatal care. And here on the TV, mothers are watching the tutorial and then learning it. And this is the result of Banaskantha district. Keep going. This is the results of Banaskantha district, where the average weight gain of the baby is more than 30 grams, which is amazing. 60% of babies have gained more than 30 grams a day, which is amazing. That means almost 1 kg a month. So 3 kg baby will beat 6 kg in 3 months of age. Okay, next please, keep going. So this is our focus to kind of make India Atmanirbhar on all the different skills which are required to be healthy and and to be well nourished. Okay, all right.
Okay, thank you.
Yeah.
If you're finished, are you finished, Dr. Rupal Dalal?
Yeah. Just let me see if there are any other slides. I don't think so, but just keep going and let me see if there are any other slides.
Actually, time is short.
Okay, yeah, this is my last slide. Okay, so So this is our clinic in urban slums. And this is where we learned about maternal and infant young child nutrition. Literally, we did not learn in books or any of these guidelines, you know. So please, you know, just definitely contact me if you want us to train, or if you want access to this, you know, videos. These are totally kind of available free of cost if you want to watch it on YouTube. Thank you.
Thank you. Thank you. Thank you so much, Dr. Rupal Dara, for your wonderful insight on, you know, the correct techniques on breastfeeding, and the solution lies with us only, and we don't have to go for nutrition outside, and such insights can be really helpful for India and Bharat as well. So with this, we are coming to the end of the first, you know, the second session on the lead speakers, and now I would request my partner, Mr. Rubab Sood, to take over for the panel discussions. So over to you, Dr. Rubab.
Thank you so much, Madam Indu. It was really very impressive to hear the lead speakers talk about such important issues pertaining to today's theme, which is STI for society under the social infrastructure sector. I think we are behind schedule, so without any further ado, I would request first speaker discussion. We've got 4 presentations. I would request all the eminent speakers to please to the time limit of 15 minutes. The first presentation is by Shri Satyaveer Singh, who's Digital India from the Digital India Corporation. His topic is training of women artisans students on CHIC, which is CAD software for skill enhancement on Khaka and I think it's Khaki and craft design. Over to you, Satyaveerji.
Yeah, thank you, sir. Thank you very much. Thank you, Dr. Datta and the team, complete C division. So thank you for providing this opportunity to present the technologies of Digital India Corporation. Basically, Digital India Corporation is a not-for-profit organization set up by Ministry of Electronics and Information Technology for taking the technologies to the masses, to the grassroots level. And as Dr. Datta told, this is a time for technological intervention. So just in a brief, I'm going to present how we are, introducing technology or technological solutions for the benefit of community. So next slide, please. So this is actually, we are running a project like a Women Technology Park at Vasni, Varanasi. So the along with the Science Stroke Rural Development Varanasi. So these are just part of this, where we are providing training on some of the software like a CHIC-CAD. CHIC-CAD is like started from chicken curry design of Lucknow. So basically what we are doing in this training session, we are training to the trainers first, and trainers are providing training to the artisans, weavers. This is totally dedicated to women community. So please, next slide, please. Here you can say how the girls are creating designs, digital designs, and these digital designs, can be printed on butter paper. Butter paper they usually use to trace the design on cloth, and then on the cloth they can use the design for embroidery, zari, zardozi, fulkari, and different arts can be transfer to the cloth using the software. We trained around more than 400 artisans, women, girl at this center, and overall we trained more than 5,000 women throughout the centers. We have other centers also, and created more than 800 digital designs. So these are the designs which have been created by the women artisans or students during the training sessions, and they created some of the products, finished products, this is like part of their training session. So as initially we were discussing like a skill development, this is a part of skill development. We are training them. They can like create their designs. They can reuse and reproduce these designs, because the paper designs is very difficult to reuse and reproduce. But here it will be like a digital database of designs which will be reusable by others, and if required they can sell their designs through this database also. This we are very soon we are going to create a big repository for the design, which can be sell out through a framework. Next slide, please. This is another component where we use like ICT based content for providing training on food processing. Basically, this was based on the requirement, because in that area, based on the available fruits and vegetables, we are training them to preserve and process the foods and vegetables available at that season, so they can get more benefit rather than selling the vegetable and fruits directly. They can process these. Next, please. So again, there was an issue for SHGs or individuals. How can they, make the record of their items, their equipments? So we have another software in the name of eGalla. That's a small software to maintain the inventory and their in out. All the records will be maintained through this software. So again, this will help them to manage the their product inventory, and they can analyze their profit and their investment through the software also. Next, please. Yeah, I think the last two speakers, Dr. Veena Rao and Dr. Rupal, they were mostly focused on nutritional component. So here we are also, doing some awareness programs. So we have some components. We worked with All India Institute of Medical Sciences. We created some multimedia content as well through Community Medicine Department. So here we are just making them aware with the basic or local issues. We are connecting the community with the local health professionals. So this is just our intervention to make them aware with the local issues, their severity, and connecting with the available health facilities in that area. Next, please. So this is again a MIS system which we are managing the record of all the beneficiaries, trainees. They can be monitored through online system. This is completely developed by Digital India Corporation. This is a MIS software to manage their data, their records, their designs through this portal. Next, please. So as I was explaining regarding ChickCat. ChickCat is like this software where we can create our designs. This will help the users to create the a symmetric design in a very lesser time. They can create a small petal, a single petal, and this will within seconds there will be possibility to create the complete flower. So we are providing basic building tools like motifs and other component of that design, so they can use these motifs, their designs as a building block, and they can create their digital designs as per the requirement, as per the their innovative or creative designs. So this is like compatible with the design digital pen tablets also, because sometimes they are mostly used to pen and pad sort of pattern. So we are providing this same facility in a digital era, because they can have a digital pen, digital tablet, and they can directly either draw or they can redraw the design. If design is available, they can put on the digital pad, they can redraw the design using this digital pad. So these are the digital technologies available for like a vector graphics. So next. Okay, the previous that software was for vector graphics, which is like available under open source category for the embroidery designs. This is another software developed by Digital India Corporation, the name of DG Bunai. This DG Bunai is like for the like a weaving process. This software reduce the pre-loom processing time. I mean, before start weaving, a design need more than 2 to 3 weeks to start the weaving. So this software is capable to create a design or any sort of photograph. You can create a photograph into fabric design. So all the process can be stored as a digital form, or they can have a printout. The weavers can see the like actual, almost close to real look of that fabric before weaving. So basically this save their time as well as money, because without the software, they have to create a fabric sample for getting the orders from customers. But the software is helping to generate a digital fabric sample, and based on the digital fabric sample, they can get orders from the customers. So this software is also available free of cost under open source categories. This can be used by the weavers, graph makers, artisans, designers. So these are the two software which are available under the like CAD category of Digital India Corporations. Next.
Satyadeep, I'll request you to please wrap up in next minute.
Just within 2 minutes, I'll complete. So okay, I will just skip. Yeah, okay. This is all process which we need to go through. So we have already existing users in different states. The people are using. They are providing their feedback on the usability of the software. Next, please. So yeah, that's these softwares are developed for with the community intervention. So I mean, all the like major sort of institutions are part of this development activities. Next, please. So if you, I mean, moderator will allow just there is small video for 2 minutes, 3 minutes. So sir, can we start that video if time permits? The video is regarding
sir, I would
software.
request, like, we will put that video on the website, sir, and because we are running short of time.
Sure, I'm sure. No.
Yes, and
Yeah,
Satyadeep, if you could put the link of that video in the chat window, I'm sure a lot of people who want to refer to that can
okay,
see that.
I'll do that. Definitely, sir. So there are some like marketing events where DST is also supporting in that area. So and whatever the WTP we are running, this is like a project funded by DST C division, and Indu ma'am is a coordinator from DST. Thank you, ma'am. Next, please. Again, that is a thank you very much, ma'am, for providing this opportunity. Thank you all the participants. Thank you very much.
Thank you, Satyadeep, for a very interesting presentation, and what you mentioned about the initiatives by Digital India Corporation are pretty interesting. In fact, the chicken curry on CAD and DigiBunai, I think, is phenomenal and remarkable work which you've done, especially the
thank you, sir. Thank you very much.
e-Galla concept. A bookkeeping, I think, is one of the very fundamental aspects for these self-help groups. When they are doing their business management and business strategy, I think that is a very welcome initiative, and I congratulate you for that. Thank you.
Thank you very much. And our partner is also part of this, web series, like Mr. Ajay Kumar from SIRD and other colleagues, Mr. Gaurav Thakkar and Dr. Rishikesh Kumar Singh also part of this.
Thank you.
So
Thank you.
Thank you.
Moving on, the next presentation, I would like to welcome Dr. J. Akhilandeshwari from Sona College of Technology, Salem. His presentation is titled Agri BPO. We have his presentation. Yes, it's on the screen now. May I now request Dr. J. Akhilandeshwari to take on from here, please.
Thank you, sir. Good afternoon, everyone. Thanks for the opportunity given for sharing our experiences in implementing this project. This project is being funded by DST for implementing this for the women farmers in and around Salem rural areas. This project is the ICT intervention to promote entrepreneurship development of women SSGs in Salem district. So in this project, next slide please, madam. As we all know, agriculture is the primary occupation of a lot of people in India, and more than 50% of the people are involved in doing this agriculture. But we can see that many of them not aware of the different technologies available, different schemes available, and more than other things are not known to them. Because the area that they have their land for agriculture is rural, and they have few technological interventions for their own good. And another one thing is that even though the yield is very good, and even though the value of the thing is very good, if the rain is also good, everything is good. But if there is any value breakdown, that can demolish the whole attitude of the farmers. That's what is happening now. So what we thought is that we can go for an ICT-based intervention, that too for the women farmers, because we all know that women are more involved in farming activities along with the men. So we would like to have an ICT intervention for the women farmers, and we wanted to group them so that whatever knowledge gained by one women farmer can be disseminated to all other peer women farmers in the same village. So we also wanted to help them with the help with this tool to manage their crop better, and also to have a trade kind of thing. Because in the tool that we have developed, we had given them the daily price. What is the price that has been given for each of the crop that they grow in their land. So along with this background, so our objective or motivation is that we wanted to build a lightweight web portal. Next slide, please. We wanted to build a lightweight web portal which is also responsive, which can work with their very cheap smartphone also. So with that, what we have done is that one of the main deliverable is the web portal, and the Android app, which can show whatever we have developed in that portal. One other innovation that we have brought in this is that apart from developing this web portal, we have designed our own weather monitoring toolkit with the wind speed sensors, temperature sensor, humidity sensors, and we have designed it, and we have given them along with the system to all the women farmers. So we have actually trained 30 beneficiaries who are direct beneficiaries, and those 30 women farmers have to in turn train 5 more women farmers in their own village. So they form a self-help group among themselves for dissemination of whatever knowledge that they have gained through this web portal. So we have established a help desk software, which is basically written in both English and Tamil. English, it's for the DST perspective, and Tamil for distributing that particular thing to the women farmers who can read only Tamil. And we have given training on that thing, and constantly for the past 3 years when we have developed this project, we have upgraded the technology. So when we started, it was only a normal web-based design. Then we went on to full stack development, technological upgradation that we have done. And currently, our students are taking care of maintaining that web portal. And intensively, we have trained all the beneficiaries, 150 beneficiaries, that is 30 direct beneficiary and 120 indirect beneficiaries in our premises and also in KVK. So we have sought help from Kishan Vigyan Kendra for implementing this project and identifying the farmers. We have sought the help from the agriculture department, state agriculture department and district agriculture department, because we wanted to have women farmers who are very active in this field and very responsive and receptive in whatever we have initiated. Also, we have developed women entrepreneurs with their own business plans, because we brought out people from different arena. I'll tell you in a few slides. We have brought them out and we have instigated the entrepreneurial skill in few of the women farmer, and they have become entrepreneurs now, where they have created value added product from their own field. And then we have taken those women farmers to different field visits, where those farmers have used ICT as one of the tools for their own improvement of their agricultural produces. And then we have conducted various programs for them apart from the training program on the software, like doubling the farmers' income, challenges and opportunities. Because of that only, I told you that few women farmers have got the idea of starting their own company, and they have started giving value-added produces from their own agricultural land. Next slide, please. So for developing this actual product, what we have done is that we have started selecting women farmers whose primary occupation is farming, and the knowledge level that we have fixed as a minimum is high school, because they'll have to go through that the software, go through the different navigational pages in the web portal, and the knowledge of handling the Android app. And we found that the beneficiaries that we have selected, they have traditional knowledge and they practiced both. There is a mixture of practicing in both organic way and chemical way. But when we interacted with those farmers, what we have found is that basically all the farmers in and around Salem, what they have mentioned is that they don't want to go organically. Because what they say is that they couldn't get much yield from the organic farming, but through chemical fertilizers, the yield is so good, so that their profit margin is so good. That's what they said. So after hearing that, then we started giving them lots of awareness program on organically going out, producing the agricultural produces, and what are the benefits. And that's why we have taken them to different real farm visits to people who have used organic farming and yielding very good and earning much more money in organic farming also. For transfer adoption, these are the methods that we have started implement things. So we have started training them through slides, through PowerPoint. When we brought them to our college, we have given them around 6 training programs, and then we have trained them on the field, because after distributing them, we have distributed them one computer, an UPS, and then a printer and weather monitoring kit. The weather monitoring kit we have interfaced with the web portal. So in real time, it will show what is the temperature, what is the wind speed, what is the rainfall, and everything it will show in real time. And so when we started installing that in the direct beneficiaries, we have conducted training with the direct beneficiary and also with the indirect beneficiaries. And we have given them system usage training. We have given them field trip training. and handouts in different usage. We had given them in regional language, that is in Tamil. So the current status of the project is that we have completed it, and we are now still continuing with this project with our SONA CSRA. In our institution, we have social corporate social responsibility initiative cell. Through that cell, with the help of the MBA department, we are now taken the survey of how well they are using this ICT initiative for their own good and for also their peers. That's what we are doing. And another initiative is that because as a project investigator, I belong to an information technology department. So with the help of my students and my fellow teachers, along with the MCA department and computer science and engineering department, we have now started building a e-marketplace for the agricultural produces alone by differentiating perishable and non-perishable agricultural produces. We wanted that marketplace to become a wholesome marketplace like Amazon or Flipkart only for the agriculture market produces. We want to eliminate the middlemen who involved between the farmers and also the consumers. So because of the middlemen between these two people, the consumers are getting the producers for a high price, and the farmers are also not able to get.
And can you wind up in 2 minutes?
Yes, madam. Yeah, I'll do that. Yes, thank you. So that's what we have done. And based on the experience that we have done, we have submitted few projects to do DST itself in blockchain. For example, seed certification using blockchain, and also a scheme money distribution to the farmers based on blockchain. Next slide, please. These are some of the photographs of whatever we have done along with the farmers. And the value proposition that I've already told you, few of the farmers have turned up as an entrepreneur, like Kanaga Lakshmi, Shanti, Satya, Beenambal, etc. They have given value-added products because of the program that we have conducted with the doubling the farmers' income. So the resource person for that program was Dr. N. Parasuraman, principal scientist of MS Swaminathan Research Foundation, and then Murugesh Bhupati, who is a former vice chancellor of Tamil Nadu Agricultural University, Dr. Srinivasan, who is the member secretary for Tamil Nadu Science and Technology Council. So we have invited these people and given them lots of inputs on how they can become entrepreneurs from the value-added products. Next slide, please. The business model that we have evolved is the hub and spoke model, where the 30 direct beneficiaries are acting as hub, and the indirect beneficiaries, 5 farmers for each of the direct beneficiaries, that is 120 farmers, will become a spoke. So we have planned to elongate this model further to add more peer farmers from the nearby villages also. So we have identified 5 blocks to implement this project, Vomulur, Mahadanjavadi, etc. for doing this. Next slide, please. So the tangible benefits is that we have created a farmers forum so that they can talk among themselves regarding the experiences and exposures they've got, and it is a multiplier effect. And we have made the farmers to have a doubling of income, and then most importantly, the usage of ICT tools, because it has become pervasive now. Each and every people who over in this world are using ICT tools for their own goodness. And the most important is that the entrepreneurship skill that they have earned among themselves. Next slide, please. So we have actually collaborated already with Kishan Vigyan Kendra, Tamil Nadu Agricultural University, FPOs, MSSRF, and State Agriculture Department, and NABARD, and a few NGOs who had now we have approached NGOs to implement this project and take it further technologically to help them further. Thank you so much for the DST, Dr. Datta and Dr. Indupuri ma'am, for giving fun to implement this project. And for us, it has become a very good learning that we have learned something new about farmers and the challenges that they face and the issues they face. And we are very open for any kind of collaborations and taking it further. Thank you so much.
Thank you so much, madam, for your very detailed presentation. I think in a way, you Sona College of Technology, I think you're doing a remarkable job of really enhancing the level of entrepreneurship amongst the rural audience, especially the women empowerment job which you are doing through various skill development interventions. The hub and spoke model which you mentioned with the peer program, I think that is a very well appreciated and a tested model. And I'm sure it's going to get better, with more work with Sona Technology College is doing. Thank you so much. Moving on, we are really behind schedule. I would now request a very eminent speaker, Dr. A. Sharif, Chairman, Department of Telemedicine, SCT facility at AIIMS, New Delhi. He would be touching upon and talking with us on telemedicine and comprehensive rural health services, a very fundamental topic and subject when we talk about social infrastructure. Over to you, Dr. Sharif. Thank you so much.
Thank you. Thank you. Good afternoon, everybody. And at the outset, I would like to thank the Department of Science and Technology, Dr. Datta and his team for actually, making these scientific projects possible in the rural areas. And I also want to thank my own parent institution, that is All India Institute of Medical Sciences, New Delhi, for the support that we have got from our own director and all my faculty colleagues in providing healthcare services to the rural populations of some of the very backward areas of some districts in Bihar. So, can I have the next slide, please? So, this is the real picture, and this is the reality, the real life of the people on whom we set out to conduct research. And here, in this particular talk, I would like to share some of the difficulties that we have faced and how we could actually address those difficulties, so that anybody else who is planning such projects may benefit from our experience. So here, these are some of the pictures of the children whose you can see so gross deformities of the legs and the bones. All these are all due to the toxicity of fluoride, the fluoride toxicity or the fluorosis in the community. So now I should tell you that apart from the illiteracy, social and economic backwardness, malnutrition, it is like adding insult to injury. There is toxicity arising out of the drinking water, and that directly seems to be the reason for such miserable lives of the people of the communities in whom we have started our research projects. And the fundamental difficulty of doing research in such communities is that we were not the first people who have gone there to conduct this kind of research. There have been a lot of people who have gone there to conduct research, and they have collected the data, and then the people are actually fed up of the researchers coming, taking pictures, collecting data, collecting samples, and going back, and which does not make any difference to the lives of those people. So the first reaction when we went to those communities is to drive us off. That it's like they were totally non-cooperative. So it's like we had to make our way through and reach out to the main people, and then give some kind of assurances that we will try to do something for the community. And that is when we thought that apart from just collecting data and conducting research, we should also have some kind of interventions which will actually help these people in some way. So that, I think, it took us time to gain their confidence. And gradually we planned that we should not only collect the data from them and then go back and publish in very high impact journals, and that may not make much difference to the lives of these people. So that is why we proposed that we should have we should try to mitigate the basic problem that these people are facing. So that was the toxicity in the water, and then we just started looking for mitigation of that particular toxicity, and luckily we came across filters which do not even require electricity, which can be attached to the hand pumps, and then they were drastically reducing the amount of fluoride in the drinking water. So I think we will share some of these experiences with you. Next slide, please. So actually, we are having a second project from the DST, and the DST has been very generous in funding this project. And I'm sure we as well as the communities are very grateful for this kind of support that we have been getting from the DST. So first thing we had to do was to identify the areas, the districts which have more than 60% of the SC population, and then we had to identify the subjects who are actually exposed to fluoride in those areas. That means we had to identify the places where there was significant amount of fluoride in the water, and we had to survey the kind of a somewhat symptomatic survey, checking for dental fluorosis, skeletal fluorosis, some symptoms of fluoride toxicity in the people. Then we have evaluated the urinary and the serum fluoride levels to confirm the diagnosis of fluoride toxicity, and then we counseled them about the cause of the disease and the ways to avoid exposure and management of fluoride-induced illnesses, that is dental and skeletal fluorosis. So one of the difficulties we had that because of the chronicity of this problem, which has been spanning over generations, the people started believing that there is no cure for this particular condition, and this was a curse of God or goddesses, that through their generation they are supposed to suffer like this and then die, and there was no remedy for this. And this is one difficult thing that we had to overcome and tell them that there is a cause for this, and the cause is in the water that they have been drinking over the generations. So we planned some interventions, that is, we just tried to install defluoridation units, and in the previous project we have installed about 10 defluoridation units, and in the current project which we have just started, and again I have to be very grateful to the DST for funding generously for this project. And apart from this, we have also tried to provide the supplements, like Madam Veena Rao has rightly pointed out that the micronutrient deficiency and malnutrition is actually complicating the toxicities. The same fluoride contaminated water, if it is taken by a well-nourished person and a malnourished person, the well-nourished person is not even suffering from the toxicity. The malnourished person is suffering very severe toxicity and very severe deformities. So we wanted to address this malnutrition as one of the interventions, just to show that if you address the malnutrition, even if there is fluoride in the water, it doesn't affect the people that much. So this is the kind of interventions we have done, and we have actually wound up that project, and the project report is under preparation now. And we have seen that there is marked improvement in the health conditions, and there is reduction of pain, and there are significant improvement in the anemia, that is hemoglobin levels have gone up, and basal metabolic index has improved, and the subjects, the people who are not able to work because of this condition and because of the pain that they were facing, they started going for work, and which actually started helping them in earning something, and then having better food, and some way it was trying to improve the living conditions or the quality of life. Next slide, please. So some of the things which we have done by way of research is that we just monitored the oxidative stress in the samples of the serum that we collected from these people, and then we have advised against using the water which is more. Suppose there are multiple sources of groundwater in a village, there may be 4 or 5 sources. We have gone and tested each of those sources, and then we try to identify the least contaminated source, and we put a green tick on top of that. And then we explain to the villagers that if there is a red cross, they should not use that water for drinking or for cooking, but they can use it for washing and for washing the cattle and all those things. So, and this has worked because we could not actually install the filters in all the places possible because we had limited resources, and ours is basically a scientific research project. It's not a waterworks or a public welfare project. So we could not actually provide the water pumps in every place, though the people have been asking us in all the places. So this is one thing that has worked quite well, because there are relatively safe drinking water sources in the villages, even if they had to walk half a kilometer or so, and the people were readily willing. Once they have found that there is a benefit, once there is an improvement in their condition if they change the water, so there was some kind of an acceptance for this. So ultimately, we could convince the people by counseling that this is not a curse of God, but it is a contaminated water that is responsible for these conditions which they have been suffering through generations. Because even in utero, unborn babies are also affected because their mothers and grandmothers have been drinking this water over so many hundreds of years. So that is why they started believing that it was a curse of God. Next slide, please. Can I have the next slide, please? I think the slide is.
Vigyan, the third team, can you help please in pushing the slide?
Hello, ma'am. There is a technical issue. The internet is slow actually, so we are just looking into it.
So, sir, if you can continue talking about your, slides which are coming up.
So now, apart from this,
for you to wrap up, sir, please. We've got another.
Apart from providing this, safe drinking water, we also started supplementing the, micronutrients and antacids and multivitamins and antioxidants and all these things. And this has definitely improved the health outcomes of these people, and they started feeling better because the source of the toxin has been removed, and then we have been supplementing because there was severe deficiency because of all the factors Madam Veena Rao has very well explained at the beginning of this session, because all those factors are also operational in these communities. The lack of literacy and poverty and lack of proper food and all those things. So to some extent, we just wanted to make this one of the interventions, apart from safe drinking water. Next, please. This is one of the places where we have gone and inaugurated the where we have installed the water filters in the hand pump. And again, luckily for us, there were hand pumps which may or may not have been operational, and we just got them repaired. And then on top of that, we fixed this kind of filters which don't require any electricity. And then there is a lever. All the water need not be filtered. So only for drinking and for cooking, they turn the lever to the safe water and they collect that water. And then if it is required for washing and for all other purposes, they just turn the lever the other side. So that way that increases the lifetime of the filter, and that these filters are very inexpensive to maintain over the long run. Maybe 100 rupees per month or something like that. And then at least 5 to 10 families can benefit from one filter. Next, please. Luckily for us, there are a lot of well-meaning people who got associated with our projects, and Professor Bihari Singh and other people who have been working with UNESCO and various other projects. They also gave us a big helping hand, because it is not possible for us sitting in AIMS New Delhi to keep monitoring all the filters that we have installed there. And their boys are constantly, every 15 days, they are collecting the samples, they are analyzing and seeing that the filter is in good working condition. In some of the places, the fluoride used to be 10 ppm, and once the water is filtered, it is getting reduced to 0.05 ppm. So we were very happy with that. And then the support of these boys in the field in constantly monitoring the filter and recharging the filter resins and all those things, that is of great help. And I would like to thank those boys working with Dr. Bihari Singh and his team in Bihar. So these are some of the immediate benefits which we could document. So there was resistant anemia. Resistant anemia is normally anemia response to iron supplements. But in cases where there is fluoride toxicity, no amount of iron supplement is able to reduce anemia. And once we eliminated the source of the toxin, they immediately started responding and their hemoglobin has come up. And the nutritional status has increased, improved, and the oxidative stress has been reduced. All these things we could actually document through our this thing. So in fact, we have established a first of its kind clinical ecotoxicology facility in the All India Institute of Medical Sciences last year. And this facility has been instrumental in enabling us assess most of these micronutrients and all other things. And such facilities were not existent earlier. So all these, birth weight has improved, and there are so many parameters that we have checked. And the best of all is the community got sensitized about the fluoride-related health problems. Now they know that the fluoride toxicity can give rise to most of the health problems that they have been suffering from. So now they are actually amenable to taking treatment, and they are likely to go and seek medical advice, and then they come and demand safe drinking water from us. Though we are not able to provide to all of them, we just at least we succeeded in educating and bringing in awareness in the people. Next, please. So there are some other additional. Then we have identified villages where there is acute malnutrition, and then there is high prevalence of micronutrient deficiency, and there is high prevalence of leukorrhea, which is a white discharge, white vaginal discharge, and there can be many causes of that. And low blood pressure, gastritis, and bone deformities. Some of them may or may not be directly related to fluoride toxicity. So anyway, we have to investigate this. And there are some villages where cancer prevalence is very high, and there may be some heavy metal toxicities associated with the water in those areas. And then we are planning to plan some projects to investigate those, because now we have facilities for assessing heavy metals in the human body fluids. Next, please. So this is our new project. Again, the DST has very generously funded this project. And then in this we have our clinical colleagues also, because when we went to the fields and there were only so much medical help we could provide in the field, and when we wanted some expert opinion, we had to revert back to our colleagues who are in AIMS. So in the new project, we have also included some of those colleagues from some of the departments where there are very commonly found conditions in the field. So like orthopedics and physical medicine and rehabilitation, urology and ENT. And in some of these, when we were in the field, when we were at a loss to provide the medical help, we could actually call back. We were using some kind of a telemedicine. We used to call back and then show the patients video and photographs and then take advice from them. And then we were actually able to guide the patients then and there in the field using the telemedicine facilities that we already have at AIMS. So for this, I am very grateful to my clinical colleagues who have readily extended this telemedicine support to our subjects in the field. So again, these are some of the areas where we could actually provide telemedicine facilities. Yeah, in the bottom left, you can see that there is a child who is severely retarded and severe fluorosis patient was there, and we could actually provide teleconsultation through the cell phone with a colleague sitting in our own office in AIMS New Delhi. So this is how we could actually extend the telemedicine services. Thank you.
Thank you so much, Dr. Sharif, for a very highly informative and very impressive presentation. We've done some path-breaking interventions, which have far-reaching health benefits, and I think this is what has been the need of the hour for our country. the toxicology facility which you mentioned, I think it was also it's a very timely initiative, and I think we have got very limited such facilities in the country. But with this recent one which you just mentioned, I think that is a capacity we need to build in our country. And thank you so much, and I really congratulate you for the great work you're doing. Thank you.
Thank you.
Moving on to the last presentation, but definitely not the least, Dr. Sanjeev from Chandigarh University. He would be enlightening us and speaking about portable bench for rural schools. That's a very interesting concept. Can we have his presentation on the screen, please? Yes, that's right there. Portable laboratory workbench for learning and prototyping. Over to you, Dr.
Hi, thanks for this opportunity to speak. This is a portable laboratory workbench for learning and prototyping, which we have developed under the aegis of Tyson from the C division. Can you please go to the next slide? Yeah, so how we came to this, because we have a division in our university who keep doing surveys at different times. So we have done a survey in which we have found that Punjab share approx more than 500 kilometers border with Pakistan. The areas are, Gurdaspur, Amritsar, Taran and Firozpur. These areas are facing a lot of issues when we come to the education because of due to selling from the other side, less facility in the schools due to uncertainty at the border area, lack of development of the transport facility. So when we went there and we seen, the students doesn't have the access to the labs and especially to the experiments from the class 6 to 12. So can we go to the next slide? Can we go to next slide, please? Next slide. Yeah, and this is again a data which we have took out from the ISA, where we have also observed that a lot of students who are leaving, who are not opting for the science. So on base of that, we have done a survey in our university and then in a school, in the schools also. And what we have find that you can see it here, more than 80% of the students who said that we don't have the access or we haven't learned computer proficiency, lab tools, project making. And we went to schools, the survey gave us more insights where the students are saying that 71% of the students says that in our school, we just see the demonstrations. And only 5% students say that we have the access to new tools and technologies. So after doing this, we said that we'll develop this technology. Can we go to the next slide? Yeah, so these are the objectives, and for this objective I also want to thank Dr. Rasmi, who is a principal scientist in ISTI Scientist Team, because once we got the project, time to time she visited and observed the projects and gave us a lot of insights which actually help us in changing our project. So now these are the three objectives when we created our projects we kept in mind. First, it should be affordable, second, it should be compact, and third, it should be innovative, because the problems which rural areas are facing, especially border area in Punjab, that they cannot create a lab. So they said if we get a portable kind of lab where we can teach most number of experiments to our students. When we came back and when we discussed with our scientists, we have 4 people who worked in this project. So they gave us one more insight that why can't, and definitely Dr. Rasmi also gave us an insight and said, why can't you creating a combined platform where the students of class 6, 7, 8, 9, 10 also should learn, and they should lean towards the science, that okay, we can also go and we also want to learn some of the experiments in the science. So we have created a platform which is a combination where the class 5, 6 student can also learn experiment of science and technology, plus 11, 12 students can also learn, so that when they go to the first year in the university, they should not go and stand in the lab and say we don't know any experiments how to do this. So can you please go to the next slide? Yeah, so these are the experiments which include the domain catered are the physics, chemistry, biology, AI, robotics, electronics, computing. The device which we have collected, I'm just going to demonstrate the device also. So these are the domains which it is creating. Can we go to the next slide, please? These are the list of some experiments. Let me tell you here, right now we have included 52 total experiments which are from NCERT and approved experiment. But in our device, you can go up to more than 250 experiments which can be done. This whole software has been also developed by our own team, who is going to demonstrate in a while. Can you please move on to slides? So in few next slides, you will find out these are the experiments of different biology, mathematics. Can you please move on? Yeah, this is AI and robotics, which are the experiments, vision processing and other experiments which can be done on this particular platform. Can you please move on? Electronics and computing. Can you please go to the next slide, which is a visual of this. This is the visual of the prototype which we have developed, and from the month of January we are going to distribute it in the schools, for which we have already partnered with some MNCs. Can you please go to the next slide? I am going fast because I want to demonstrate. Also, these are the views of the experiments which can be done through this particular portable laboratory. Please move on. These are the experiments of AI and other mathematics and other experiments. Please go to the next slide. Our main vision that it's written here, but now as we said that we have tied up with 2 MNCs, so we are going to deliver this portable bench to 150 schools which are on the border areas of Firozpur, Amritsar and Taran. So these 3 districts we have chosen for the first phase, where we are going to deliver these portable laboratories. We'll start from the January and we'll end this project by the next December. Please go to the next slide. And then we have done one more thing during this particular project, because we got this project in 2019 March, and 2020 we encountered with the COVID. So again, as suggested by Dr. Rasmi, we have also created a sanitizer bench. We have modified our objectives, and we didn't took any fund from the DST, but in the same project we have created a portable sanitizer bench. So on which one can manufacture approx 400 liters total sanitizer in a day, plus 250 masks, and this is a foldable, so it can come within a suitcase, so it can go to any hilly or the rural areas. Can you please go to the next slide? Yes, so this is about that what you can do with this, because in the rural areas what we found that in Punjab also there is a lot of rural and border area, plus in the Himachal hilly areas they have faced a very shortage of sanitizer and masks. So we have planned that can we plan something by which not only we can serve to these rural areas, but some of the poor people or low income people can also start their startup and earn their livelihood. So with this vision we have created this bench. Can you please go to next slide? Yeah, so these are the features of portable bench. It's designed the mini size, and speedy mixing process. It's also a touchless process. You don't need to touch, no electricity contact for mixer or liquid, which is again a big concern when we are created. The people told us automatic touchless dispensing system, consistent product and quality and stability. Because let me tell you, we have already manufactured 5,000 liters sanitizer, and we have delivered this sanitizer to 3 worst hit communities of the society. One, we have delivered this to AIMS. We have also delivered in Safdarjung Hospital. We have delivered it to Punjab and Haryana Police. And third, we have delivered to all the laborers who are working in the district of Mohali, Ludhiana and Ropar. So total 5,000 liter sanitizer we have distributed, and there we have tested these particular benches also. Can we please move to the next slide? So this is a picture of that equipment. Which we have created. So now I've gone through a bit quickly because we want to demonstrate you. Can you please go to next slide, please?
Hello.
Can you please move to next? Yeah, and this particular our bench is already adopted by 2 of the startups. It's already in the technology transfer, and there is one company of the Ludhiana who gave us their willingness to buy this particular product. This product is costing total 8,000 rupees when we are manufacturing it at the bulk level. So we are already transferring this. So with this, what I can do, I'll take you to the demonstration. That's why I went a bit quickly, so that you can have a look of these products live. Can you please start?
So this is our portable boxes that you are looking at. So
This workers, as you can see over here, and we are that was created by us. As you can see, students and different concepts of physics, chemistry, biology, mathematics, and economics. So let's get into the biology. I showed you Microsoft to invite the student audience to
Can I request others?
I think we cannot see anything. So I think there's no, we cannot see anything. I know and here, so we cannot. I think there is no use of operating.
I
this.
hope. No, I hope it is. Is it visible now?
Yeah, it is. It is visible. Quickly, can you do it like now? Yeah.
Okay. Yeah.
So I'm going to demonstrate physics part of it. So this is a demonstration of simple harmonic motion. You can see this ball bearing. So if I will release this ball, so once I release this ball, it will keep on noting down the readings, and we will be able to calculate the length of the string. Similarly, optics experiments can be also done over here. So this is the optic kit that we have prepared. So if I turn on this kit, and I can be in students, class students can be demonstrated the converging and divergence experiments as well. Similarly, prism, where light will be divided into multiple colors as well. So to cater the chemistry part, we have enabled this with multiple experiments. I can demonstrate one where we have enabled this with the pH sensor. So if I go to this drinking water, I'll put my pH sensor over here, and I can go down to my chemistry part of the kit, and I will be able to note down the pH values of the kit as well. Then there is one more part where this whole system is enabled by different programming languages of modern world. You can see from Arduino to Scratch to Python to Java, all things are updated over here. One more USP is that this is also enabled by all those robotics kits and computing part as well. Different companies sell these for 70,000-80,000. I will not take their names, but we are also integrating that part in this whole platform as well. The second leg of our project is this sanitizer maker. So as you can see, everything came out of this suitcase, as you can see over here. So this is our mask making module, where you can make your mask, and those masks will be collected in this basket. Then this is our sanitizer module, which is actually, the mixture is contactless. So if I turn on this module, you will find that within few seconds it starts stirring automatically, as you can see over here. And once this stirrer is it has been completely sealed. Again, it's a contactless concept. So I just swipe my hand, and it will fill a 250 ml sanitizer into my bottle, and it will automatically stop itself. So you don't need to touch anything. So it is completely contactless kind of thing. So this was now you can see the whole kind. This is completely portable in nature.
So that's it from our side. Thank you.
Thank you so much, Dr. Sanjeet, for a very unique and an interesting presentation, which has a solution which is very apt. The portable workbench for learning and prototyping. The portable sanitizer benches was something very timely, and we must congratulate you there for that. And thank you for the little demonstration you made. It was very useful. Thank you. On that note, now, ladies and gentlemen, we have done the panel discussion before presentations. I'm sure I personally feel more aware and more enlightened after these few presentations of today. I would now request Madam Indu, Dr. Indu, to please take it on from here.
Thank you, Dr. Rubab. Now we are heading towards the concluding this wonderful, virtual session, which was so enlightening and truly from where we started, social infrastructure, जो समाज को जोड़ने के लिए बहुत जरूरी है. It has been shown in all aspects, be it the lead speakers, discussions and the panel discussions. People have tried to resolve the issue of, border problem by making virtual, labs, which are totally, through electronics and through computers, you can create a virtual lab. I was really impressed, and some of the projects which we have supported in the seed, like the CAD software, where they have tried to associate chicken curry with the modern embroidery techniques, and Dr. Sharif's exemplary work of, going to the grassroots and solving the centuries-old problem of fluorosis and all that whatnot. So before Dr. Datta concludes the full sessions, both the sessions, I would like to take some quick questions. I know we are running short of time, but Vigyan Prasar has very nicely compiled some of the questions. So after that, and these questions will also be available with solutions on the on our website. So first question which I see is from Vigyan Ashram to Shri Satyaveer Singh Ji, that sir, we are using Usha Genome and Brothers digital embroidery machine. It has priority software. Can your software be used on these machines? So basically, Mr. Satyaveer Singh, are you there? Satyaveer Ji, aap hain wahan par? I think he has left, but we will post your question on the website, and this can be answered because CAD software ke, I think this should be doable. And the next question is from Dr. Gopi Krishna to Dr. Akhilandeshwari. That is about, more awareness should be given to farmers and about the price realization of organic products. If the products are organically certified, they fetch more price. It's more of a suggestion rather than a question, rather than verbally saying that they are originally produced. So any comments on that, Dr. Akhilandeshwari? Dr. Akhilandeshwari, are you there?
Yes, madam, yes. So I have answered there. So we have already taken this up, and with the same farmers who are beneficiaries with us, we have talking them to make their land organically, at least part of their land as organic, and certify them. So because we know one farmer who had made his whole agricultural land as organic, and he had obtained certification also, and actually he's earning more than what he has earned in a normal agricultural farming activity. So we have taken him as an example and creating awareness among our beneficiaries.
So, madam, there is also a question whether these agri BPO services now they are free or are they chargeable to farmers? And the farmers, how do they pay?
No, yes, madam. This is actually for the farmers that we have developed it as free one. Only after, because we are now planned to make it as a marketplace app. So only after having a full-fledged app development based on this web portal, we have planned to have it as a chargeable one. So that then that becomes a self-sustainable one.
Okay, madam. Thank you. These were the questions to you. And now there are some questions for Dr. Sharif. There is a lot of scope for livelihood generation in the business of fortified energy foods, utilizing locally available food items and recipes produced by the rural women through micro enterprises. These can be supported in terms of marketing and obtaining FSSAI certification. Again, this is more of a suggestion from Rajiv Guliani sir. And then there is another question from Deepa Gawali. That is, can you share the defluorinated techniques that are example low cost and people could benefit, sir? Sir, any comments on that?
Sure, ma'am. We will send you the details. Already there in the project reports that we have submitted, but again we will give you separately. so that you can share with everybody on the web portal. And about,
Okay,
these locally available foods, ma'am, I think UNICEF and a lot of agencies started promoting this moringa leaf and powdered moringa leaf, and to be mixed with the dough, because it is very rich in antioxidants and iron and all, so it addresses many of these malnutrition problems. And there is another
locally available chakora bhaji.
Yeah, there is another plant called chakora bhaji.
Locally available, they are making saag, and they are putting it in vegetable also, and it has high calcium and iron. That's why somewhat it is helping. It is, what is the problem? The target like beneficiary is landless, so we can't suggest for any plantation, and they don't have place to
grow them. Yeah. And these plants were actually earlier growing as weed, and nobody knew the nutritional value of this. But now I think they are actually promoting these plants a lot, because they don't require. Yeah. So I think, yeah, definitely there is a market for locally available and enriched foods. I think that has to be promoted. Unconventional, leaves and vegetables have to be promoted.
Thank you, sir. Thank you for that, wonderful insight that low cost, things like moringa can help us. And this is we always look for expensive solutions, but simple solutions are also there. So next question is to Dr. Sanjeet Singh. Sir, are you there? The challenge is to have quality instructors. Hope you are planning to overcome it. So again, it is a suggestion. And the next question is the portable bench inclusive? This is a question to Dr. Sanjeet Singh from Dr. Gopi Krishna. Dr. Sanjeet Singh, if you would like to comment on that, is the portable bench inclusive?
Ma'am, there are two things. The first thing, can you please repeat the first question, ma'am?
The first question is, challenge is to have a quality instructors. How you are planning to overcome it? Like what they mean to say that, okay, the machine is there, which will be, replicating many experiments. But who is going to give the instructions in the border areas? There will be dearth of teachers also. That's what I understand is the question.
So thanks for your question, ma'am. So let me answer this question, because in Chandigarh University, as I've already said, that we have a team. We have created a team. We have a central research facility. We have 60 scientists who don't teach, who do our research and this kind of work. We have already trained more than 60,000 students in the state of Punjab in science and innovation. And for this particular, this lab which we have shown you, for this lab, there are 5 PIs who are working. There are 5 people. They all are from different computer science, electronics. And then there is a team of 20 people which we have already created. When we are saying that we are going to distribute 150 bench, and we have already partnered it with one of the MNCs. So how we planned, why I said that it will take 1 year. I didn't say that we can distribute it within 2 months. So we made it in the phases that every time we'll take 20 schools, and one of our instructors will stay there for 15 days and train their people. So we already given the training module, and this has been already shared with our scientists from DST. We already told them that we are going to do this, because this project came in 2019 and we are in the early stage. So we have the time of 1 year, which we can do. And plus our university also gave 50% of that full project funding. So this will help us. Plus the MNCs with whom we have collaborated, they also said that we are going to give you money under CSR. So we have enough capital from where we can fund these 20 people so that they can stay in those schools for 15 days. So at one time we train 20 schools. So in 7 months we can reach to our target. This is the answer of the question, ma'am. I hope you got the answer.
Thank you, sir. Thank you so much. And the second question was about whether this is inclusive or not, this thing.
And ma'am, the first thing, let me answer for the first thing also. When we have done it for Punjab, there are some rural border areas in Rajasthan and other states also, Gujarat also. So we are open to that also. If there is any NGO or any organization who want to partner with us, our trainers can go there and train there also. They can stay there also. We are open for this also. Because this is funding. And in second, let me tell you, this the lab bench which you have seen. This lab is already fitted with a braille. We'll give the braille technologies for the keyboard. That definitely will be there. Other than this, there are two things we are giving. We are giving all the instructions manual in the regional language. We have already done it for the Punjabi languages because our first target is Punjab for sure. But after that, if anybody will partner with us, we can give them in the regional language. Other than that, we have also fitting, including it with the language translation audio software, so that whatever they can say in English, if anybody want to hear in their regional language, that's also we are developing, and I hope we can come out with that within 3 months.
That surely is quite inclusive. So thank you, Dr. Sanjeev Singh ji. And then there is a question from Dr. Dorai Raj to Dr. Pranav Jha. Dr. Jha, are you there? The question is TV UHF brand legal to use? Sir, that is the question. Are you there, sir?
Yes, I'm there. I have already answered it over the chat.
So can you, for the benefit of all the audience, can you say a line or two on that?
So it is allocated to Doordarshan, for 470 to 590, and you need to get permission if you want to use it for experimental purposes. So that permission has to be from the DOT.
Okay.
Otherwise,
thank you. Okay. Yeah. Then there is a next question from Dr. Gopi Krishna also to Dr. Jha. Was Groundmark a pilot project, or is it workable solution to meet the broadband connectivity in rural India? What should be the speed?
Yeah, I provided a detailed answer to him. Yeah, so it was a pilot project because at an academic institution it is difficult for us to develop a full-fledged product and deploy it in the field. But we deployed it in the field in 25 villages in the Palghar district, and it was running for multiple months. So we think that it can be taken forward and used as a commercial deployment also. Obviously, there will be a lot of work required to do that, but the basic concept can be easily taken to the because we have done.
Thank you. Yeah. Thank you, sir. Thank you so much. And you have given in writing also, like to him. So I think you have covered most of the things. And then there is a small question from CARD BBSR to Dr. Rupal Dalal. That can we get the training and model to train the rural girls and women? Those are not much educated. Ma'am, are you there? So can you answer that?
Yeah, absolutely. Actually, these tutorials are literally our target audiences, uneducated, obviously we want to educate them, but basically passing on the knowledge. But yes, these tutorials are in such an easy language that anybody can be trained.
So thank you so much for all that. Now I would request Dr. Datta sir, will you please sum up the wonderful session of panelists as well as the lead speakers. So over to you, Dr. Datta.
Thank you very much for all of you to be actively the part of these discussions, and also Indu, you have already taken the question answers. And before I summarize it and what are the opportunities I find, I will take the view of our technical advisory group members here. I see here Dr. Anil Joshi. Dr. Joshi, this is a new directions and the new way of the infrastructures we are talking about. What's your view? How this type of the social infrastructures way of this, is it the right directions, or what is your the comments on this, Dr. Joshi? Dr. Joshi, I see that he was. Dr. Joshi, yeah.
Dr. Joshi, can you hear Dr. Datta sir? I think, sir, there is a bandwidth problem.
Bandwidth issue. I think you can put your video off. Probably that will be better here.
Sure, sure.
Okay. I think there is a the bandwidth issue.
There is a problem there.
Yeah.
Now
video you can put it off. Yeah. Video put off here. अब
अभी आपकी आवाज आ रही है मेरी?
हाँ अभी आवाज आ रही है आप हाँ ये this is better. Yeah.
अब आ रही है. मैं ये कह रहा था कि something very important. ये देखिए अब हमको एक काम करना चाहिए because I'm speaking I'm my comment is on the first speaker. रीना जी, it's really 3 decades में 3-4 decades last. What had happened suddenly? We are malnourished, undernourished, and what? Because there are couple things which we have ignored largely. Our food has been invaded in the past. You see why I'm saying so? कि हम पहाड़ों में जो खाते थे, राजस्थान में जो खाते थे, it is totally invaded. एक चीज ये समझनी चाहिए क्योंकि ये so called malnourished, undernourished that came 3-4 decades last story only. और होता क्या था? What we used to eat, we grow around. And not only that, what we grow, but our dependence was also on the wild resources. And that used to add a lot of immunity and nutritional needs of the community. And it was a physiological matching and different climatic zone was and different resources. It was, if I'm born in a, I am supported with some of the wild plants around me. And that's a physiological matching was within the climate and food needs and human physiology. So what I think that this has been totally broken because I remember we earlier used to eat a lot of within our food system. There were 30 to 40% of millets and many wild fruits we used to eat, wild resources. But it is totally going on, and that is one market we have been saying. But it is the market only which has invaded our food. That has to be understood. Therefore, we'll have to go in a different way around. We should produce the local market, which is said earlier also, and value add the resources that we have and try to find out the local community also consume the same, and also we become the market for others. So when we do that, so there will be any health security issues also that will be covered, and also an economic drive will also come, which will be totally new. As Corona time में दो बातें बड़ी अच्छी हुई है. अब ये कितना भी आप किसको कह दो, एक तो हेल्थ इनसिक्योरिटी जो सबने फील किया, सबको एवरीबडी वाज रियलाइजिंग कि क्या खाएं क्या ना खाएं, फोन में पूछ रहे हैं काढ़ा पिएंगे, ये पिएंगे, सो करेंगे. दैट्स वन एडवांटेज आई फील. नंबर 1. दूसरी बात ये है कि ये भी आना शुरू हो गया कि गांव के रिसोर्सेज आर वेरी रिच बाय न्यूट्रिशन, एंड that's one thing which is a very important area where we can involve ourselves with the technology and knowledge science. But essentially what I want to highlight here is that every agroclimate region, every climatic zone and the human bond there have a physiological matching, and we had gone away from our own food system. You shouldn't forget, we behaved very well this time, performed very well. Corona invaded. India was the fast recovering because of our food, and it was highly talked across the globe. The Indians ka fast recovery kyun hai, and why there is immunity within Indians. Because still we have a time that we will have to take go back to our tradition, understand that ecosystem we were living with, and मुझे लगता है उसके आगे के रास्ते तैयार हो सकते हैं. Thank you.
Can I just respond to that? Because I think there were certain comments which were made.
Yeah. Yes,
Okay,
madam. Yes, madam.
Yes, Joshi, thank you so much. You made some very, very valid and relevant comments. And actually, since, I have studied this subject, this whole malnutrition in India's society, ill health and malnutrition in India's society was something building up over the last 2 centuries since we are going back. Because as you know better than me, there was a shift of people from non-agriculture earning activities to agriculture. There was a complete conversion of agriculture land into cash crop, mostly opium or indigo or whatever it was. So there were 3 things happening together. Education was going down completely because the local schools were all closed and because there was no funding. Then you had people from non-agriculture sectors shifting to agriculture. Agriculture holdings were getting smaller, incomes were getting smaller. There were no other occupations, as well as the fertile plains of a lot of rivers were being converted. So ill health, malnutrition started coming. And the first food surveys, which were done in 1935, showed huge amounts of malnutrition in the whole country. And Dr. Bohr, who came out with a report in 1943, said that it was only 30% of our population which was in a proper state of nutrition. And our first 5-year plan is based on the findings of the food surveys. But I completely agree with you. After that, well, the government has tried many strategies to overcome it. But that's a study by itself. I won't go into that. But you're absolutely right. Whatever was left of good nutritional practices, such as eating what we call coarse grains, that is bajra, ragi, that was all replaced by white cereals, whether it was rice under the PDS or other things marketed. So there I totally agree with you, but now that is that's a different subject.
1950, the stories are different. The famine, we were not producing as much. That was one factor, the poverty, because the people do not have access to the adequate food. That would have been one reason. But currently, if you look into the kind of food we are eating, see, so many food stores have invaded our food.
Absolutely, absolutely.
You say it's all,
But if I may just interrupt, what has happened is there is plenty of energy food made from locally available materials like what we say, ragi, etc., but very high cost. Low cost is nothing from locally available materials. In fact, we are going in for that, and that's a major reason. There is a direct correlation between availability of low-cost energy food, which local industry is just not going in for, perhaps monopolistic tendencies of multinationals. That is another discussion by itself. So, in fact, we are going in for it, and I hope I have very good news to give you by December, because we hope to reach the market in December for a 5 rupee packet of food for children, 10 rupee packet for adolescents and adults, which is made from ragi, it is made from roasted wheat, it is made from jaggery, it is made from peanuts and defatted soya. That's all locally available. Right now, you have kurkuras of 5 rupees for the poor. You have no energy food. So chips you have. So what is behind this? I think our friends from FICCI can tell us better.
Yeah, I think
badly needed in the market, Dr. Joshi.
Yeah, I think what we need, I was reading in the Economics Time. One of the market leaders, like one of the industrialists, I'm not going to take his name. He spoke about what the corporate sector needs to develop for the Atmanirbhar Bharat is a PQ model. The PQ is a profit people. Profit and people should be in the considered, together, because only profit without people, that is not a sustainable model. I think our industry should understand, and And here we have a role as part of the government, the partner of the private sector, to respond to that and develop a that type of model, like which is where it is not only profit, but the people should also be a part of it. So I think rather than like to summarize the thing, like our start itself was wonderfully done by Binaji. I think her plethora of the experience in the service and the insight, which converted our scientific base, because really the social capitals, what are the components, she put it very nicely. I just want to share 5, 6 points, but because of the technical reasons she couldn't share. Probably that was the real conclusions or summarizations of what she spoke about. So since I have her whole PPT with me, I would like to the way forward what she spoke about, that for the information deficit, in order to address, there should be nutrition and health knowledge hubs. So this can give a new directions towards our women technology park also. The women technology parks can be one component of this, is the nutrition and the health knowledge hubs. What has happened in the total government system? Whenever we talk about that the improvement of the community, we find that the value addition and selling to the market is the only way out. What happens that we are utilizing the local resources, the local skill, the local people, and then we are giving it to the in the middlemen who are getting the benefits and giving very less back to the internal component of the the livelihood system, which is very important for us. Atmanirbharata is not only the money. Atmanirbharata is like what she has told, that the addressing the nutrition value chain starting from a child and adolescence and as an adult. When like a healthy, we have to understand that really, if you want to make India the future, India cannot be only the market. India has to be a healthy India that which will be a which can make India that not only as a market, but we are now. Everyone is looking towards India, rural India as a market, but we have to make a healthy India, nutritionally, the self-sufficiency India. I think that is the message, and like what she has given, some of the other the training women SDGs to this start small business for fortified energy food. And she's right. Like today we talk about like all these billets, but you see that the multinationals have already captured it, and you find in all the the racks of all the big markets, you will find that all the things that the value added, the amount of the money we pay, probably like one like 20th of that doesn't go to the really the producers. So this is a time like we have to think like that. The way forward is to create food nutrition value chains, horticulture nutrition linkage at the decentralized block level, and establish agriculture nutrition linkage at the decentralized block level. Vinaji, like as a part of our the project, what we're going to start, like definitely we'll start it. We want to experiment these things, and I would request all of our the non-governmental organization partners and the other partners, and also FICCI, to bring really the startups in these directions. The startups are not here to serve to the only the outside the market. When the global the corporates are targeting the Indian village, Indian rural asset market, why our startups can only be the supplier to the global chain? Because only there is a the value advantage of that. So we have to look into it and break the chain. And I think the science, technology, and innovation can play an important role, and then only the role of the STI, the science, technology, innovations will be the important thing. So I think what we heard from the the other discussions, Dr. Char it has given a very the full 5G network, utilizing a part of the Doordarshan's the spectrum they use, and definitely Dr. Jha, we would be interested to use experimenting with many of the other aspirational districts which are not connected well with the in the main the web network, and if it can be valid, we can even work together with the Metis, because it's a time to work with the other ministries also. So we can talk to the Metis and can take this as an upscale of the experiment. Dr. Rupal Dalal actually brought a very whatever Madam Veena Rao told, she brought the other new directions, because science is not only laboratory things. Science is in communicating the right information is also part of the doing science, and she brought it. And I believe what she talked about, that spoken tutorial. Ms. Indu, I will suggest that this can be a part of our all of the Women Technology Park like this. If we start pushing this thing, people will, and since it is in the different languages, we have Women Technology Park all over the India in different languages. We can check it, and then this can be a part of the package. Where we can.
Definitely, I think a lot of potential there. Yeah,
and I think Dr. Satyavir Singh, what he has told, I think this is an opportunity for what Dr. Satyavir Singh has told, that we have done a project only in Banaras area with this DigiCat, and with the strength of our the digital India corporations. This at least the open source the software which is available. Actually, one questions I think you didn't take, there was a questions already from Dr. I think from Vigyan Ashram. Dr. Kulkarni already told that they are using Usha Genome and Brothers digital embroidery machines, whether the this open source software can be used here. So that's the way, please. Whether our core support groups and beyond the core support groups, the other NGOs, this is an opportunity to take our the technological advantage in improving the efficiency of our artisans. And the Indian artisans, because of our so much of the diversity and the cultural diversity, can be a big area for improving their the efficiency, and this is one aspect of it. Sona College, I think what they have done, my suggestions will be that definitely what they have done, that the APO can be upscaled. We can talk to Metis with that, how it can be taken. But before you go to blockchain, please consult and come back to us with a community, yours, and the NGO partner combinations project. We don't want only your idea to go into the community, whether the community has the requirement and to bridge these things, because Sona College cannot infinite way can give them the benefit, can support them. That's not your that is not your mandate. So we need an intermediate NGO or some startups whose capacity nearer to the community can they improve their situations. Dr. Sharif, I think already he has offered that is their experience and the technology which can be taken by the others, the other non-governmental groups and the other developmental groups taken their field. And I think the same with Dr. Sanjeet. I think these are the components of our technology, developed for our people. What it is needed is in mass upscaling in our way to create a market which is not only to get the profit, but also keep up the requirement of the people. And so I think with that, I was a little apprehensive about that. The social infrastructures, how do we kick off? I think we have started well, and it will give a new directions to our thinking and our the intervention process. And tomorrow, when we'll be listening it from another group of the NGOs and the communities, will speak from the the requirement from the field. Probably we will find out many more opportunities and the new way of working. So with this, I think if anyone have any comments or any one of you want to, we are almost nearing 5 o'clock. So I think any comments from anyone or any things? Yes, madam. Yeah, please, yeah, Binaji, yeah.
Thank you. I just like to thank you. You summed it up beautifully. I think you picked up all the critical points. And I'm sure after you have heard all the other stakeholders on your list, you will compile them and send them to us, I'm sure.
Sure.
So,
actually, every day I'm doing it, and at the end we will not only compile the recommendations, we will compile it our what will be our roadmap. And everything consult all of you in order to take. And I think before I close down, I will request I think Dr. Ketaki Bapat from the PSA office is here, madam, for the last comment from you.
Thank you.
Yeah. Thank you all the panelists for really, it was an enchanting sessions and well conducted, very well conducted by Bob and Dr. Ritu also. What I felt, this is a new dimensions we are also seeing. Right now, even seed program or even UTAC program, we were never thinking so much. We were aware that okay, nutrition is required and other things, but very beautifully, Veena Rao and then I felt, as Dr. Anil Joshi also said, a lot of new dimensions we have got, and I would also request that all of our group and all our committee will take a note of it, and maybe some additional thing we can do. My only question is that even though we have used this digital mechanism or AI and your work, how can we do it to integrate with the ministry initiative for women and child development and all these kind of study or whatever observations, whether it will be sufficient pushing forward or any other with our community level organizations or something we need to do. So that maybe we need to take a look at it so that we can definitely use this results for our larger population benefit. And I again congratulate, and all this session, today's session was really a feast in the sense it was really, all the topics were so well connected. So I would also thank the organizers to choose very aptly, that very interesting session. And we will definitely take a note of it. It was very interesting, and thank you all. Over.
Thank you, Dr. Bapat, and thank you for your, for thanking us, which I share with my colleagues, because all of us has worked together and put our mind together, and now we have to putting our hands together so that we can really convert our mind into actions. So thank you for all of you who stayed with us. We had 102 the participants of the committee. We say now 60. So I think that shows the nucleus of our interest, and that gives us the energy, because nucleus is the source of our energy, and we expect your the energy and support, and we come back and meet tomorrow. And I request all of you who are here to be there tomorrow, because it is, as I told, this is a clinic, and we do not know all the medicines. It is all in our mind, and we have to put our mind together. Thank you again. Thank you.
Thank you, everyone, and thank you for the participation.